Hi, I'm Gavin Giovannoni. I'm an academic neurologist based at the Royal London Hospital and at the Queen Mary University of London. And I'd like to thank you for joining me today on this Moving Science podcast, where we will discuss the holistic management of MS, in particular lifestyle interventions. And joining me today is Dr. Agne Straukiene, a neurologist from Devon in the UK. Welcome, Agne.
Thank you for having me on this podcast.
Maybe you should just give us a little background to your career and how you got to the UK and your training, etc.
My journey into the world of multiple sclerosis and lifestyle medicine began at the Lithuanian University of Health Science, a place where I was fortunate to be introduced to a lifestyle medicine, a field I initially underestimated. As a student, becoming a young doctor, I envisioned a traditional role for doctors diagnosing and prescribing medications as the primary mode of treatment. There's nothing else that you can do for yourself. That was my impression. However, I quickly realized that medications alone could not address the full spectrum of the patient needs. So I think it's super important to have that collaborative work together, and that was a realization very early at the beginning of my career. And I know that a lot of depended significantly on how individuals manage their health throughout lifestyle choices. And this discovery was pivotal. It propelled me into the field of neurology, specifically multiple sclerosis, as a complex, multifaceted disease that fascinated me as a student, because I knew that there is a diversity of the symptoms and made it an excellent foundation for broader neurological education. So I knew that if you could learn to examine patients with MS, I would know the rest of the neurology. And I immersed myself in the field and inspired by prominent distinguished neurologists like Professor Malsiena, Professor Budrys in Lithuania, who were my mentors and supporters throughout my career. And later I moved into the UK in 2011, and I met with Professor Hobart and Professor Zajcik in the UK, and I gained my further experience in multiple sclerosis by doing the 3-year MS fellowship. And my passion deepened as I took on a leadership role in the MS service at Torbay Hospital, where I pioneered the integration of lifestyle interventions into the patient care. We introduced comprehensive lifestyle clinics focusing on diet, sleep, exercises, and meditation, and the results were profound. Our analysis suggests that patients who are living healthier, they have fewer hospital admissions and fewer comorbidities compared to the services across the UK. This success has only fueled our commitment to refine and expand these programs, emphasizing a precision holistic medicine approach tailored to the individual needs of those living with multiple sclerosis.
That's an impressive one, and you've inspired a lot of us in the UK to try and adopt your practices. But I suppose the big issue is not every NHS trust or any healthcare system is prepared to accept these lifestyle interventions. I'll just give you an example. When I was first starting in my hospital back in 2008 and 9, we tried to set up a wellness service. And you can imagine going to the managers asking for resources for a wellness service, and they laughed at us. So we managed to fund it with research funds for 6 months, where we employed a physiotherapist and an occupational therapist to people with MS that were, in inverted commas, well. And actually, to my surprise, over half the people we sent to them patients that we thought were completely well, nothing wrong with them. And the therapists uncovered that over half of them had problems that needed to be sorted out medically. So it just shows you how disconnected a neurologist's brain is from what lifestyle medicine is. So I think there's also a learning. We think that we're doing the best for our patients, but a lot more can be done if you dig down. This brings me to the next question, Agne. What is the biggest challenge in the management of MS in terms of getting this adopted? Your approach to managing MS adopted internationally, say?
Yeah, well, I see several significant challenges here. Firstly, the variability of the disease poses a considerable obstacle. MS can vary greatly from person to person. Nobody's the same. We meet each individual and they have different symptoms, different trajectory of the disease, progression, severity. And this variability requires a highly personalized approach to treatment, which can complicate the standardization of the care protocols. Like, we can't use the same approach to everyone, and we need to adapt very rapidly in this environment and landscape of multiple sclerosis. And secondly, another major challenge, as you mentioned, the integration of the lifestyle interventions into the standard medical care. So it's an increasing recognition of the importance of diet, exercise, mental health, and managing MS effectively. And to integrate alongside the medical treatments requires systemic changes. It's like the whole system, the whole pathways change, bringing the wellness into the routine. It involves not only educating patients, but also training the healthcare providers, because not many people know what is the actual lifestyle and what would suit individual. And altering the infrastructures, it can be, as you mentioned, resource intensive, and it costs a lot of money, and it can slow down us to implement things and changes within the service. And lastly, I think is the ongoing need for patient education and engagement. I think managing MS effectively requires patients to actively participate in their treatment plans, which can include significant lifestyle changes. And not everyone is keen to change their behaviors and adherence. And we know that people who are prone to be on the healthier pathway, they adhere better to the complex medication regimes. And ensuring that patients have the knowledge, motivation, and support, they need to manage their condition over a long period of time. It's not the disease that you have a day or two or a week or month. Overall, it's a lifelong condition. And it's crucial with educational tools to help people and improve their outcomes. I think these challenges are substantial, and they also offer opportunities for more innovative solutions and improvements in how we care for individuals with multiple sclerosis.
Yeah, so how do you activate I shouldn't make it, is it the right term, patient activation, in terms of getting people to engage with this program?
Well, it's the whole process. How do we motivate patients? So initially, they might be indifferent or passive about managing their multiple sclerosis because it's a significant challenge, and also a crucial aspect of effective care is getting engagement. And motivation is deeply personal matter. It varies on individual level and influenced by a variety of factors like patient's psychological status, whether they are depressed or anxious, the whole support system and connection and network they have in place, and the overall understanding of the disease. There are several strategies that we do day to day. Number one is education. I think this is what you do with your MS Selfie, and we do the same with the Be Well with MS podcast. We try to educate people and motivate them in providing comprehensive education about MS and potential progression of this disease if you're not too careful, and an impact of active management and their quality of life. And I think the more you personalize patients' care and customize the treatment and management plan aligned with the individual lifestyle preferences and goals, this helps to see their treatment regime as more durable and relevant to their daily lives. And setting the goals is super important, that they are achievable, short-term goals leading to long-term benefits, using the technology tools, utilizing digital tools that empower patients to track their symptoms, their progress. We provide the reminders, we communicate, we send text messages via self-management platform, educational materials and library content. And there are some support groups. My MS coordinator just started going to the coffee events. There are a group of patients who gather together to discuss things, and that's an opportunity to engage and sort of set a support network that comes from us, from the healthcare providers, and integrating ourselves as a healthcare provider into the patient's community and giving them constructive feedback during the consultations, and celebrating their improvements, discussing challenges openly without hiding anything, adjusting the treatment as needed, enhancing the trust and motivating people that they stay engaged if we do that. And of course, we are closely working with the mental health support services like psychologists, occupational therapists, physiotherapists, and addressing these psychological barriers. There might be a barrier, and integrating mental health support into the care plan is super important. As we know, depression, anxiety is around 50-60% of people with MS suffering with this condition, which may undermine motivation, and addressing these can improve their overall engagement. And of course, also making sure that people come to talk to us, and there is a support from the family and friends. This is super important, and educating and involving the patient's family and friends in their care, creating the supportive community that encourage the positive health behaviors and help patients adhere to the management plan. So that these sort of key strategies that we sort of try to follow day to day.
So you did mention using a technology. So can you give some more details about what you're using from a technology perspective to help implement your plan?
Well, yeah. So technology has become a cornerstone of how we manage multiple sclerosis patients today, significantly enhancing our ability to monitor and support their treatments and overall health. So we use the Patient Knows Best platform, where people access the library content, they can track their symptoms, they can look at their lab results, they can text us and message us for some advice and help. And that's very helpful. We also have created Connect Plus app, where people can access the information about their condition, have listed charities, have video content of the exercise that could follow. They were created and guided by the physiotherapists with experience in multiple sclerosis. They can also come to our virtual clinics using this app. So these kind of technologies and tools that we have implemented, and it suggests quite positive results. The interim analysis comparing patients using the self-management platform like PKB to those who don't use the PKB revealed some very insightful findings. We are just discussing with our analysts at the moment in trying to publish this data. We observed that patients engaged with the digital platforms exhibited slower disease progression and benefited from early initiation of the treatment.
I suppose the one thing you got to be aware of is the kind of people that will engage, maybe the ones that do better because they have more cognitive reserve or something like that. So I suppose at the moment it's you need to do a randomized trial to be 100% sure, wouldn't you?
Lifestyle could be a complementary. Disease-modifying therapies are crucial, but they are important part of patients' care because they are directly influencing the disease course, reduce the relapses, can slow down the progression of disability. However, the factors associated with the more holistic management, such as addressing lifestyle elements, diet, exercise, mental health, it helps to understand people better. And it sort of helps to predict whether they are going to adhere to the medicine, if they are going to adhere to the lifestyle. I think it cannot replace us yet, and we want to use more comprehensive, broader approach, integrating lifestyle into the DMT's pathway.
So one of the pushbacks you're going to get, and when I mentioned the holistic management of MS, is that neurologists just don't have the time, the bandwidth to do this, and they think lifestyle medicine should be run by the family doctor or other healthcare professionals. Do you think that argument holds? That neurologists shouldn't engage with it, but just refer their patients to other healthcare services to do all this lifestyle interventions?
It's essential to view that the management of lifestyle factors in MS is a multidisciplinary effort. While neurologists have a critical role in overseeing and coordinating care specifically to MS, including the prescription and management of the disease-modifying therapies, monitoring DMT's effect, I think that they should also be aware of the significant impact of lifestyle factors that have on disease progression and on patients' quality of life. Neurologists' best position is to initiate and guide conversations about the lifestyle modifications early in the disease process, given their detailed understanding of MS and its management. I think that's important. Also, neurologists can assess the specific needs for their MS patients and recommend interventions that are tailored and personalized to their neurological needs. That being said, it's practical and often necessary for the ongoing management of these lifestyle factors to be handled in the collaboration with other healthcare providers, whether it's a family doctor, a GP, a dietitian, a physical therapist, occupational therapist, mental health professionals can provide the continuous support and detailed attention is required for each individual, and that addresses the lifestyle management. So overall, I think it's a collaborative work. As a long-term solution is we have to rely on the community, but for that immediate assessment and tailored personalized pathway and care that involves the holistic approach, neurologists plays an initial role in doing these things and producing the plans that would enhance patients' well-being and outcomes.
So I know from a NHS, and I assume this is a other healthcare system approach, they always want to show that these interventions are cost effective. In other words, it's worth investing in services. Is there any data out there to support a business case to set up a lifestyle management program in an MS service to show that it's cost effective?
I think currently what we have in the lifestyle medicine and multiple sclerosis specifically, we have a lot of surveys and questionnaires that addresses the quality of life, impact on the fatigue, better symptom management, but we haven't got, as you say, the randomized control clinical trials to assess the benefits. So it really becomes very challenging and difficult to set up a business case. However, we can look at the simple things and what any healthcare manager would be interested in the cost effectiveness and comorbidities and admission rates to the emergency department, ED or other hospital units and wards. I think what we're lacking here in terms of the research in lifestyle, I think is the longitudinal data that assess the efficacy of the healthy living and healthy lifestyle and its long-term outcomes. Some objectivizing behaviors correlating with maybe biomarkers like neurofilaments, kappa light chain index, MRI findings on brain atrophy, slowly expanding lesions, paramagnetic lesions, cognition, microglia, all these kind of, we're talking about the smoldering element of the MS. I believe that the lifestyle really plays a role in saving the mitochondria, which is, the energy to the cell and giving that nourishment at the very biology level. And I think also what would be useful in lifestyle medicine to have more quantitative precision medicine-based approach. Like I have a feeling and I envision that artificial intelligence is going to revolutionize every field of medicine, and it's slowly growing in the field. And without the doubt, it will occupy the headlines in the next few years in the context of the precise and faster measurements and helping us to differentiate the diagnosis, getting the symptoms correct, adjusting the symptoms, using these tools, uncovering new variants maybe of the disease and neurological status and identifying the early progression of the disease. And I think every lab, whether it's lifestyle brain health lab or biological agent preventive medicine lab, is going to have data scientists working on the deep learning models using the powerful tools to answer new questions. In particular, we have to utilize more objective measures, which is imaging, maybe some genetic data, and we might discover a lot of new things, and lifestyle plays a key role in that. And we need to know the cause of multiple sclerosis. Once we know the cause, exactly what's causing and driving this challenging, difficult disease, I think we will come closer to the cure, because we really want to understand better this condition.
Yes, I'm a big proponent of what you're saying, and I agree that, once we get AI into the equation, we may be able to refine our thinking around this disease and have a more targeted approach. The question I'm going to ask you, obviously, this lifestyle interventions, holistic management, surely everybody in society should be doing this. I mean, do you walk the talk? Do you practice it yourself?
Of course I do. So that's my lifeline. I have to, because otherwise the overall job is really draining energy, and it takes a lot of effort, mind effort and body effort to be ready to stand all day by the computer or be in the clinic, lift up paralyzed limbs of the people who are wheelchair users or are bedbound, So I try to engage myself with activities like playing tennis a few times a week. I do love going to gym on occasions. I used to dance ballroom dancing on the behalf of the Exeter University and attend the competitions. And I'm talking about not like as a child, but it's an adult, it requires a lot of physical fitness to do these things. You don't think much about it, but it's really heavy and hard. I think practicing meditation and mindfulness, that really gives a huge potential for my performance, running the Be Well with MS podcasts, doing the clinics, running the research projects, service improvement projects, it requires a lot of effort. And I think if you combine these things day to day, physical activity, mental health, mind work that I do day to day, it really gives me a lot of nourishment. And I would like to believe that, the longer I keep going like this, the more energy I will have to produce even more things in this life. And my current agenda is that I'm being trained by European Association of Neurology to become a sort of brain health ambassador. It's a very nice initiative, one brain, one mission. And I think my vision is that developing brain health hubs in the community could potentially be central to identify neurological conditions early. And it could be maybe advanced imaging technologies, genetic testing, cognitive assessment to monitor the brain health proactively. I think that's our future. And then we could, once we know how to address these issues at a very early stage, and then personalize lifestyle interventions based on their individual profiles. So what I'm trying to say here, Gavin, is not the brain health and healthy living and healthy lifestyle is not for people who already have a disease. But we have to think about, our classed at the moment normal population, people who don't have any chronic diseases. I think these are our targets as well. And I think, Gavin, you also do some research in preventative medicine, right? So this is your new niche. Tell me more about this.
No. So, it's exactly this, is how do you, at a population level, get people to focus on brain health from a very young age? Because a lot of the risk factors for dementia, play out in early life, to be honest with you. And so you have to activate. And this is why it's completely relevant to not only the person with MS, but their families, their children, etc.
Yes, absolutely agree.
So this particular series of podcasts is really about innovation. So this is like one of the final questions I want to put to you in terms of innovation. What innovations do you think need to be developed to actually cause a seismic shift in the way we manage MS from a lifestyle perspective?
I think we need to start thinking about the causal research whilst we're managing patients and trying to understand their symptoms progression, what is the priority, etc., etc. I think we need to sort of think about, do we really know what's causing this condition to be active or to be progressive? And I think what would be useful in this world is bridging knowledge gaps. There is a potential, for example, causal AI that can connect areas of the healthcare data, such as genetics, clinical records, population health data, providing a more comprehensive view of health and disease. And this integrated approach can uncover new insights that were not apparent when looking at data sources and in isolation. So I think it would be an amazing opportunity to improve the diagnostic accuracy and also develop some prevention strategies. And I think it also would help to develop new drugs, because if we know what drives very carefully at the very sort of molecular cell level, what drives the pathogenesis of the progression and which domains and cells and organelles are involved, and which receptors are dominant and which synapses are being, used, and, what particles are being released, etc. So all that sort of underlying very precise precision medicine and deploying the AI can accelerate drug developments by identifying potential targets and predicting drug responses based on the biological pathways involved in the disease. And this can reduce also the time and the cost, I think, if we do that.
So I think what you're saying is, precision medicine doesn't only apply to pharmaceuticals, but also applies to lifestyle interventions. Well, Agne, I want to thank you. So if you could just sum up then, do you mind wrapping up in a sentence or two about the potential impact that the holistic management of MS has on patient care, and why our listeners should keep a close eye on developments in this area?
Absolutely. The holistic management of multiple sclerosis represents a very transformative shift in how we approach this complex condition. By integrating a wide range of interventions, including lifestyle factors such as diet, exercise, stress management, alongside the traditional medical treatments like disease-modifying therapies, we can provide a more comprehensive care model that addresses both the physical and psychological needs of patients. And the potential impact of this approach is very, very profound, and we can improve quality of life. The holistic management can significantly enhance the overall quality of life for people with MS. This approach is very valuable because it opens the dialogue with people. We form better connection. People who are connected to you as a physician and healthcare provider, they can then implement some steps to change their behaviors and improve their lifestyle. And it empowers the patients by involving them actively in their care regime strategies. Listeners should keep a close eye on developments in this area because the field of MS management is rapidly evolving, and advances in research are continuously providing new insights into how lifestyle factors and holistic approaches can alter the course of the disease. And moreover, as technology progresses, we might utilize more AI, or other tools, machine learning. We anticipate even more innovative tools and therapies that will make implementing and tracking these holistic strategies easier and more effective. We will prove that this is cost effective and is really changing people's lives and preserves the brain health. In summary, the holistic management of MS offers really a promising path forward that not only enhances the management of the disease itself, but also significantly improves the lives of those affected by MS. Staying informed and saying all that, I hope that it will tickle everyone's hearts and minds and about these developments and can help patients, physicians, caregivers, or people alike to make the most informed decisions about the care and treatment, and never forget lifestyle interventions.
Yeah, so you've convinced me, and I have seen you talk before, and I've read what you've written, and to me it's a no-brainer. If we want to run a good quality MS service, and if we want to make, I have this concept of marginal gains, little improvements across different domains add up to a big difference in outcomes. So I think any healthcare professional listening to this who runs an MS service has to think about how they can incorporate your learnings into their practice. And if you are somebody with MS or you care for somebody with MS, you should also think about how you can optimize all the little things that go into the holistic management of MS to improve long-term outcomes. So we're running a series of podcasts on innovation in MS under the Moving Science banner. And we'd like to continue this series. So if you have any suggestions for topics that you want to hear about, please email us at ms.innovationchallenge@roche.com. And if the idea is practical and interesting, we will almost certainly consider doing a podcast on that topic. Thank you and enjoy your day.
Thank you. It was a great pleasure.